Welcome to my treatment room. This is a place I spend quite a few hours in, and I've done a lot of work to make it not only comfortable for me, but certainly for my patients. And not only do I think that the process for healing begins when you start with the application for care, but I like to think that when patients walk into the space here, that they're immediately greeted with a sense of ease, and they can begin to disarmor. My background, I've been practicing in the holistic healing arts for over 25 years. It really began when my mom passed away when she was only 51, and I have great respect for Western medicine, for what it can do for trauma and infectious disease and surgery. But I saw in her case that I think the system failed her, and quite frankly I hear this story repeatedly from many of my patients. So I knew that Western medicine as we know it has its limitations, and I've spent the past 25 years and probably will spend the rest of my life trying to understand some pieces that we may have not only forgotten but perhaps have overlooked. I became interested in traditional Chinese medicine and Ayurveda, and because these are systems of healing that are thousands of years old. And what's interesting about their model is they really don't even talk about things like diabetes or cancer or cardiovascular disease, because their perspective is that we are energy systems. Quite frankly, they feel that our field, this field out here, and you kind of know what I'm talking about, because as you encounter another person, you can immediately begin to have a sense of there's something there beyond the physical. And physics is proving this to be true, and certainly through the work that we're doing, that we know that we are more than our physical bodies. Again, MKS, multiple kinetic systems. Kinetic is just a word that means dynamic, moving. And you can see here with our logo that we've chosen, sort of like the yin and the yang, the constant flow, continuous movement. We're talking about energy. And we bring in those 5 levels that we talked about: the physical, the electromagnetic, the intuitive, the mental, and the soul body. Even when I first began as a chiropractor, and you can look here at my friend Sam, it's always interesting for me to see how patients react to seeing a skeleton. But as much as how powerful as a chiropractic adjustment can be, there were times that I knew that there was something more, and I was often drawn to the mouth. And I started to discuss that with Dr. Orris, and we began to understand the dental component from a model that we can see here in this chart. And it shows that we are connected, our feet, our spinal cord, and our jaw, and quite frankly, our matrix and every systemic issue is connected through our teeth, because they sit on these meridians. The other thing that we found is that while Dr. Orris focuses here on the bite, and you can see even as I just open up Sam's mouth here, if I don't put that together evenly, well, I can tell you that that affects every neuronal process on his autonomic nervous system. And then we also know that the feet are directly involved. If the feet are just a little turned in or a little turned out, this can affect the bite. So I think of the body as a slinky. This end and this end. And if either one of them are tweaked just a little bit, I'm talking just a nanometer, now the rest of the body has to compensate. So we began to develop MKS by recognizing these multiple levels, and certainly through my mentor, Dr. Dietrich Klinghardt, who we adopted these 5 levels from. So we may start the process by having the patient have a complete analysis from the perspective of the dental. And then Dr. Orris will send me a report, and he'll give me his notes. And then using autonomic response testing, which I'll demonstrate in just a moment, we're able to identify how the teeth and what's happening with that root canal or with that heavy metal, or quite frankly the incompatibility of different metals in the mouth, might contributing to not only muscle pain and facial pain, but to gastrointestinal issues, the malfunction of the pancreas, or even the heart. You met Bruce next door when he was with Dr. Orris, And a typical visit after the patient has seen Dr. Orris, he would send me a report and he would tell me some of his findings. Now, I introduced you to that chart before about how each tooth in the mouth can relate to a different organ, part of the spine, or even emotional component. For Bruce, for instance, I specialize in a technique called autonomic response testing. This is a very refined form of kinesiology, even if you can see right here on the chart. Applied kinesiology. This is a form of muscle testing. Using autonomic response testing, we take it to the next level. These simple tools help us to actually have a window into the body to help us see what connections might there be with the dental issues that Dr. Orris found. Now, in this case, Bruce presents with a prostate concern. We know that one of the teeth here is associated with the sex circulation meridian. Using autonomic response testing, I would test to see, is there a connection between these two? If I find that there is, now I want to find out what's going to help to correct that. Is it a homeopathic? Is it a phytotherapy? Or is there even an emotional connection? This is what takes MKS to the next level, is we're looking at not only the physical level, the electromagnetic level, the mental level, the intuitive level, and of course there's always the connection to spirit. In summary, it really doesn't matter what your politics are. I think by all consensus we agree that the United States healthcare system is broken. We're living in an environment that we've never dealt with before on our planet. We have environmental stresses and electrosmog, the likes of which antibiotics don't touch. We have to rethink how we deal with healthcare. And that's what we think MKS brings to this particular need. I think Einstein said it best, that you cannot solve a problem with the same mind that created it. So as MKS practitioners, yes, we have been accused of coloring outside the lines. And quite frankly, I take that as a compliment. How about you, John?
Thanks for coming to visit us here at MKS. This was a brief overview of more that you can find. Please wait for the information at the end of the video.